What can patients do to wreck their own treatment? The first thing is they don't tell their doctor everything that's really going on. They just give a kind of thumbnail sketch, and so the diagnosis may not be right. And if the diagnosis isn't right, perhaps the wrong treatment is prescribed. So number one, you have to give a good, adequate history to your doctor. Number two, if you get the prescription for medication, you have to take the medicine. A study in California showed that in a managed care setup where the prescriptions were free, the patients didn't have to pay anything, of patients getting an antidepressant prescription, 1 in 7 failed to pick it up. All they had to do is go upstairs to the pharmacy and pick it up. They didn't even pick it up. So point number two is you got to take the medicines if the medicines are prescribed. Or if you're in psychotherapy, especially cognitive behavioral therapy, which seems to be the most effective psychotherapy for depression, you have to actually practice what your therapist tells you to do. And then the third thing is you've got to do whatever the treatment is correctly. So one of the problems that patients on antidepressants have is they don't take their medicines right. They're supposed to take them every day. And by the way, antidepressants were designed to be taken every day, and they don't work effectively sometimes for a period of 2 to 12 weeks. But side effects may show up in the first day after you take the drug. So a lot of people have a few side effects and they just stop taking their medicines, or they don't take them correctly. They don't take them every day. They may take them every other day. And some of my patients, I've heard, when they get better, once a patient gets well, assuming they get to remission, which means getting back to pre-depression functioning. Once patients get well, they're supposed to continue taking their medication. It's called continuation phase treatment for a minimum of 6 to 12 months after they get well. And a lot of patients, once they get well, either stop taking their medicines altogether or they only take their medicines when they feel down. Well, these drugs weren't designed to be used that way. You can't just take them on a bad day. It takes longer than that for them to begin working if you've stopped taking them. So you can sabotage your treatment by either not taking the treatment in the first place, not telling your doctor everything to make a correct diagnosis, or by not using the treatments correctly. Finally, I want to mention alcohol is a depressant. Now, most people don't think of it that way. They think of it as something that reduces inhibitions and relaxes them and maybe helps them sleep. But alcohol is a depressant. It depresses blood pressure, pulse, respiration, but it also depresses mood. And so drinking too much while you're taking an antidepressant can sabotage your treatment as well. I tell my patients, it's like if you have a wound on the back of your hand. It looks bad, it smells bad, it feels bad, it's red, it's festering, there's pus coming out, and you go to your doctor and you say, look at this. And the doctor says, oh, that looks bad. Let's give you an antibiotic. This is the most powerful antibiotic that we can use on you. You take it 3 times a day, 7 days, bingo, bango, it's going to be gone. All right? So you look at these pills and you look at your wound and you decide for some crazy reason to work on your car that day without covering your wound. And so oil and transmission fluid and dirt and stuff fall in this wound, but you're taking your pills. Well, after a week, the wound is no better. Maybe it's even worse. And you look at your antibiotic pills and you say, what's wrong with these stupid pills? They're not helping. Well, the reason they're not helping is you're aggravating the wound by having all that stuff go into the wound. Well, in the same way, if you take an antidepressant but you aggravate your depression by drinking too much or using drugs that you shouldn't be taking, opiates or tranquilizers or sleeping pills or whatever. It may be that your depression will not respond to the pill, but it's not the pill's fault, it's the aggravating factor.